In this video, I'm going to explain everything you need to know about atenolol, especially what it does to the body and about specific side effects. This is especially important if you're about to start atenolol or you're already established on it. I'm also going to answer 3 frequently asked questions in my clinics. How long does it take to work? Will it affect my sex life? And can I drink alcohol while taking atenolol? These are really important questions that you should be fully informed about when making a decision about taking any medication. So let's get started with what is atenolol and how does it work? Atenolol is a beta blocker medicine used to treat high blood pressure and irregular heartbeats. If you have high blood pressure, taking atenolol helps prevent future heart disease, heart attacks and strokes. It can also be used to prevent chest pain caused by angina. Atenolol works by slowing down your heart rate, making it easier for your heart to pump blood around your body. It's sometimes prescribed to prevent migraines and help with anxiety. So how does it work? Because atenolol is a type of beta blocker, like other beta blockers, it works by changing the way your body responds to some nerve impulses, including in the heart. It slows down your heart rate and makes it easier for your heart to pump blood around your body. We don't fully understand how atenolol prevents migraines. It may work by relaxing the blood vessels involved or by reducing activity in the visual cortex. This is part of the brain where migraines are believed to start. So who can't take it? If you have low blood pressure, called hypotension, or a slow heart rate. If you have Raynaud's phenomenon, which may make your fingers and toes tingle, turn paler than usual, or turn blue. If you have metabolic acidosis, where there's too much acid in your blood, or if you have lung disease or asthma, or you're trying to get pregnant, are already pregnant or breastfeeding, or if you've ever had an allergic reaction to atenolol or any other medicine. So what's the dose? So how much atenolol you take depends on why you need it. The usual dose for adults with high blood pressure is 25 to 50 milligrams once a day. If you have angina, which is chest pain, 100 milligrams taken once a day or split into 2 50 milligram doses. If you have irregular heartbeats, it's 50 to 100 milligrams taken once a day. And if you have migraines, it's 25 milligrams to 100 milligrams taken twice a day. So when you start taking atenolol, your doctor may advise you to take your first dose before bedtime because it can make you feel dizzy. After the first dose, if you don't feel dizzy, you can take your medicine in the morning. If you're taking atenolol twice a day, try to have 1 dose in the morning and 1 dose in the evening, and it's good to leave 10 to 12 hours between the doses if you can. Atenolol doesn't usually upset your stomach, so you can take it with or without food, but it's best to do so the same time each day. Swallow the tablets whole with a drink of water. If you find them difficult to swallow, some brands have a score line to help you break the tablet in half. Check the information leaflet for your brand to see if you can do this. I also have a video that will give you tips if you have difficulty swallowing tablets, and I'll leave a link for this down below. So how long do you take it for? This depends on why you're taking atenolol. For heart conditions or high blood pressure, treatment is usually long-term and maybe for the rest of your life. For migraines, treatment can last for several months or years, depending on how bad your symptoms are. And talk to your doctor if you want to stop taking atenolol. Don't try stopping this suddenly, especially if you have heart disease. This can make your condition worse. So what are the common side effects? Feeling sleepy, tired or dizzy, cold fingers or toes, nausea or vomiting, diarrhea, stomach pain or slow heart rate. And what are the serious side effects? It happens rarely, but tell your doctor if you have shortness of breath with a cough that gets worse when you exercise, like walking upstairs. If you get swollen ankles or legs or an irregular heartbeat, these can be signs of heart problems. If you have shortness of breath, wheezing and tightening of your chest, these can be signs of lung problems. If the whites of your eyes turn yellow or your skin turns yellow, or you have pale poo or dark pee, these can be signs of liver problems. Or if you get unexplained bruising or you bruise more easily than usual, these can be signs of low number of platelets in your blood that will show up in a blood test. And call emergency services if you get chest pain that doesn't stop after a few minutes or is new, or worse if you already have angina. Chest pain is a possible sign of a heart attack and needs to be checked out as soon as possible. And in rare cases, atenolol may cause a serious allergic reaction. Now, these are not all the side effects of atenolol. For a full list, see the leaflet inside your medicines packet. Now, does it interact with any other medicines? There are some medicines that may affect the way atenolol works, so tell your doctor if you're taking other medicines for high blood pressure. The combination with atenolol may sometimes lower your blood pressure too much, which makes you feel dizzy or faint. Other medicines for an irregular heartbeat, such as amiodarone or flecainide. Medicines for asthma or chronic obstructive pulmonary disease, sometimes called COPD. If you have medicines for diabetes, particularly insulin, because atenolol may make it more difficult to recognize the warning signs of low blood sugar. If you take medicines to treat nose or sinus congestion or other cold remedies, including those you can buy in a pharmacy. Or if you have medicines for allergies such as ephedrine, noradrenaline or adrenaline. So now let's answer the most frequently asked questions in my clinic. How long does it take to work? Atenolol starts to work after about 3 hours to reduce high blood pressure, but it can take up to 2 weeks to reach its full effect. You may not feel any different when you take atenolol for high blood pressure, but this doesn't mean it's not working. It's important to keep taking your medicine. For migraines, it may take several weeks for atenolol to start making a real difference, so keep taking it. Will it affect my sex life? Now, some people on atenolol say their sex drive does go down, and some men find they cannot get an erection. If you're having problems with your sex life, talk to your doctor. Can I drink alcohol while taking atenolol? Drinking alcohol can increase the blood pressure lowering effect of atenolol, which can make you feel dizzy or lightheaded. During the first few days of taking atenolol or after an increase in your dose, it's best to stop drinking alcohol until you see how the medicine affects you. Now, if you enjoyed this video, please remember to hit the like button and hit the subscribe button if you'd like to see new videos that are posted every week. And hit the notification bell if you want to get notified about new videos. And please make a comment in the comment section to tell me what you enjoyed about this video or what topics you'd like to learn more about. You can also check out my other videos on metoprolol, bisoprolol or propranolol. Thank you for watching.